My name is Tim Long. I'm the President and the Administrative Clinical Director of New Life Medical Center, and I'm going to talk to you today about testosterone therapy. First and foremost, I'm on testosterone therapy. I've been on it for 7 years. 39% of men over 45 have medically low testosterone. And what does that mean? That means that their testosterone level falls below 300. And the ranges for normal are between 300 and 1,070. And the way they base that, why there's such a wide range, is because it's based on the age. The average 80-year-old male has a testosterone level of 300. The average 25-year-old male has a testosterone around 1,070. So if you fall, regardless of your age, if you fall within that normal range, 300 to 1,070, you're considered normal. Well, we know better than that. The reason I say medical low is because if it's below 300, insurance will cover it. If it's above 300, insurance will not. And that would have to be something you have to pay, what they call cash pay. But just because you're above 300 doesn't mean you don't have low testosterone. It really depends on your symptoms. And every guy is different. So your testosterone level may be 400, but if you're showing symptoms, for you that is low. So we look at each individual and determine whether we're going to treat that patient or not. What are some of the symptoms of low T? The biggest thing we hear, the number one reason, is people are just fatigued. They don't, they're working all day. By mid-afternoon, they're tired. When they get home at night, they don't want to do anything but lay down on the couch and watch TV. They just don't have the energy that they used to have. A lot of people think it's all based on sex drive and libido, and it's really not. That's typically about the third or fourth item or something that we hear from our patients. Most of the time, the vast majority of the time, it's energy level. They don't have the ability to lose weight. They're working out now, their diet's on point, but they just cannot seem to lose that last 15, 20 pounds, mostly around the abdomen, right around the spare tire. Also loss of, they just don't recover, they get sore. And when they work out in the yard or they work out in the gym and they just stay sore forever and they don't recover as quickly, they're losing strength, they lose muscle mass, low libido, low sex drive. They're not waking up with erections every morning, so they're having weak erections. It's just not like it used to be. They have trouble concentrating, mental fog when they sit down to work. They just can't stay focused. Short-term memory loss, moody, sense of some symptoms of depression. A lot of guys describe it as it's just like there's this dark cloud over me. Not really depressed, but just you don't have that drive, that optimism anymore. Hair loss, poor recovery after workout and injury, like I said. Even where you get a little cut and it just takes a little bit longer to heal than normal. So those are the symptoms. What are some of the causes? Normal process of aging. But the biggest thing that we see is stress. We live in a high stress environment. Life today is just fast paced. Nothing like what our parents had to grow up in, much less their parents. And we know through studies that our testosterone levels are lower than our fathers, and our fathers are lower than their fathers. And we think it has a lot to do with our fast paced society today. Obesity, chronic illnesses, and some of the medications, like if you for diabetes, high blood pressure, you have chronic liver kidney disease, genetic causes, hormonal causes, treatments for certain cancers like radiation will drive down your testosterone, which is, again, a lot of this is putting stress on your body. Obviously injury. But once you start testosterone therapy, you can eliminate most of those symptoms if you have low testosterone. The first thing this is what most people tell us. The first couple of weeks, maybe 3, and every patient's a little different. Some a little quicker, some a little longer. But the first thing they'll notice is they have abundant energy. They have that drive and that ambition. They're able to work all day and go home and spend time with kids and play with the wife and kids, and there's no problem. They have plenty of energy. They're able to sleep better. They sleep about the same amount of time or even a little bit shorter time, but they're getting better sleep. Obviously, the sex drive improves greatly. Their erections improve. A lot of times when guys come in for erectile dysfunction, 65% of the time when we get their testosterone levels at their normal levels, the erectile dysfunction goes away. So testosterone has a big part to play in the erections and the quality of the erections. the improved focus, the improved memory, the drive and motivation, kind of an overall sense of well-being kind of comes back. They're not as moody, they're not as depressed, they're not as pessimistic. They're just excited to get that excitement back. It improves your insulin resistance, which helps you lose weight. It also improves your metabolism. You'll also, when you're working out in the yard or at your job or at the gym, that you're not going to be as sore and you're going to recover quicker. So there's a lot of benefits. The testosterone in males affects almost every system in the body: the cardiovascular system, cognitive function, bone density, fat metabolism, libido, healing muscle mass strength. It affects almost the entire body. So if you're low, it's something you may want to think about. And is it safe? Absolutely is. There's been over 16,000 studies done on testosterone therapy. There's links on our website you can go check out. It's FDA approved. And as long as you're monitored properly, and we monitor our patients very closely, a minimum of every 3 months we're doing blood work. When we first start you, it's every 6 weeks. Once we find out what your levels are or where your levels need to be, and we get you balanced, then we're going to pull your blood work every 3 months minimum. And if we see any differences, we're going to pull it even more often. The only thing you really need to watch out for if you qualify for testosterone replacement therapy is your estrogen and the hematocrit and hemoglobin. When you hear stuff out on the news about it, some pro bodybuilder died, is because they usually weren't watching their estrogen and their hemoglobin and hematocrit. With estrogen, what you'll have problems with is gynecomastia, which is just swelling the breast. You can have issues with that if you don't monitor it and keep it under control for an extended period of time. With hematocrit and hemoglobin, as long as you keep that under control and you watch it and keep it down to normal levels, you're usually not going to have a problem. So it's very safe. There are millions of guys on it who use it. And if you do need it, it is something that will change your life, or we believe will change your life. We've seen it over and over and over again. Guys come in, they're lethargic, they don't have the drive or ambition, and then 4 weeks later, they're totally different men. We even had wives come in and thank us for giving their husband back. We even had there was a little period there for a little while where we're having wives bring their husbands in to see if their testosterone is low, because they're just not who they used to be. So if you have any questions about it, just come by the clinic, drop by or call, and we'll be glad to sit down and talk to you about it and explain all the different options available to you.